It was passed by Cabinet. It was an SI, a statutory instrument which indicated that all nurses, after an exercise of over 2 years, I believe, all nurses were to get a salary upgrade to bring them in line with other professionals in their area of work and similar areas of work. And the KHMH, even though it's a statutory body, is also held to that. And so we had to come up with the funds to pay retroactively back to April when the instrument was passed, as well as to put the increments in place for the new year.
I see.
And what I said inside is that this would not have been possible without the intervention and the support of the Ministry of Health, who helped us to identify the funds. The Minister himself and Dr. Allen, the CEO, both were instrumental in this process, in identifying funds through the ministry for us to do this for our nurses. And we're very, very happy that we were able to do it before the end of the year.
Okay, that's one, and then you have the...
Then I know you've heard of the PICU project. We had a groundbreaking more than a year ago now. And the fundraising efforts have been going on since that time, courtesy of Mrs. Kim Simplice Barrow, the Special Envoy for Women and Children, and the Gobi Foundation. And Alan Gobi leads that foundation, and that's a philanthropic foundation. And they took it on themselves, and they eventually got a foundation, another foundation called the Oak Foundation involved. They have been able to raise more than $1 million Belize dollars to get the project started.
Okay.
So, and during this time we have been planning, drawing diagrams.
What will it entail?
It's going to be a specialized unit occupying about 10,000 square feet of ground space, half of which will be devoted to neonatal intensive care, and it will be staged care from very critical to holdover and so on, and infectious isolation rooms for infectious cases, which we don't have at the moment, and it's the same thing for the pediatric side. So we're duplicating the layout on 2 wings essentially, and then we have all the support services in the middle and all the administrative support at the front, and then we even will have quarters for families to stay when necessary, sleeping quarters, and kitchen and dining area.
Okay. So it'll be like a mini hospital for children.
Yes, and as per request of Mrs. Barrow, she wants it to be child friendly.